Live captioning for Good Morning Texas is sponsored by Cancer Treatment Centers of America. For more information on how they're winning the fight against cancer every day, call 800-333-CTCA.
It's one of the few cancers actually on the rise in the U.S. Medical oncologist Dr. Simeon Jaggernauth, also known as Dr. Jag, of Cancer Treatment Centers of America, knows a lot about liver cancer and treatment options. So there's good news here. How prevalent is this? Why are we seeing liver cancer on the rise?
Liver cancer is on the rise because we are seeing an increase in hepatitis B and hepatitis C, which is the predominant risk factor for this disease as well. And there are other causes of it, such as excessive alcohol use. Sometimes patients have an iron overload syndrome where they build up iron in their liver, causing damage as well.
Okay. So we're seeing hepatitis B and C, we're seeing cirrhosis of the liver, heavy alcohol use, but there's other risk factors here too.
Right. There are things in the environment such as contaminated water in certain parts of the country which can do it, as well as some environmental toxins from mushrooms called the aflatoxin. And sometimes when these things go uncontrolled, they can lead to the development of cancer because of the chronic inflammation within the liver itself.
Okay, and so those are the risk factors, but then there's the other side of it, the good news. There are treatments available at Cancer Treatment Centers of America for people who are suffering.
Yes, there are. Some of the treatments available include radiofrequency ablation, chemoembolization, TheraSpheres, and sometimes chemotherapy itself can be used. Targeted therapies, new things that are available.
This is really state-of-the-art, which is really all about not only combating this disease, but keeping that patient comfortable. So you have with you a little bit of what we can expect when we go in for this treatment. What are you showing us here?
Well, I'm showing you something from the Discovery 600 PET CT, which is what we go over with all our patients when we're talking about their cancer. Here we're looking at a scan, a PET scan itself, with the disease within the liver. So here's the liver itself, right over here.
Yep, I see that.
And inside there's a bright spot right over here. And this is an area of cancer which can be treated with radiofrequency ablation. An area that is, and a machine is hooked up to a small wire, which is then inserted, and the cancer can be burned out that way without any surgery.
Wow.
So it's something that can be very helpful for those patients who cannot have any surgery and who are looking at an isolated area of disease.
There's other protective liver cancer factors that we could be doing every day. Before we get to the surgery, before we get to these treatments, there are things that we can be doing every day that reduce our risk.
Right. One thing you can do is get vaccination for hepatitis B, which is a protective factor itself.
Okay.
The other thing is drinking coffee. About 2 cups of coffee a day has a 43% reduction.
Yes, Dr. Jag. That's a big deal. And just because of the actual coffee bean itself, or is it the caffeine, or maybe a combination of
It's a combination of the antioxidants and the caffeine itself.
That's so great. And there are other treatments available that you mentioned before, and this is really the exciting news that we're learning today.
That's a new one, yes. The other thing you can do is insert tiny glass beads in the liver called TheraSphere, and something that's unique to CTCA itself. Okay.
Really good news you're bringing us for the treatment of liver cancer. Thank you so much, Dr. Jag. And Cancer Treatment Centers of America has a special offer this morning for Good Morning Texas viewers. You can receive a subscription of Cancer Fighters Thrive magazine. All you need to do is sign up at cfthrive.com/GMT. For more information about Cancer Treatment Centers of America, give them a call, 1-800-333-CTCA, or log on to cancercenter.com.